and welcome to BerryDunn's podcast, Healthcare Technology Insights. My name is Dan Vogt, and I'm a principal here with BerryDunn and lead our healthcare consulting practice. I'm hosting this podcast today, and I'm really excited about it. Healthcare Technology Insights is here to inform, instruct, and energize healthcare leaders. Our podcast will include healthcare professionals from all over the nation. We'll bring key topics for discussion that have a real impact on the healthcare industry. Speaking of healthcare leaders, our very special guest today is Brian Hadley. He's both a friend and a colleague of mine. He's a manager at our consulting team, and quite frankly, I think of him as a healthcare security geek. I mean that as the biggest possible compliment. Brian is a certified information systems security professional and a healthcare information security and privacy practitioner. So he certainly has perspective for today's podcast that might help keep our listeners up at night and hopefully give them a few tips that might make rest a little bit easier. Besides being a security professional, Brian is a proud dad of a 3-year-old son and an avid fan of Dave Matthews Band. Brian, welcome to the podcast. Glad to have you here.
Thanks very much, Dan. Happy to join you.
So let's jump into it. Let's really kind of talk about cybersecurity and healthcare data. Give our listeners a sense of your perspective when you first kind of got into this field and found your passion.
Yeah. Let's do that. Thanks, Dan. So, a lot of my focus has always been on kind of healthcare data and cybersecurity, like you said. Let me start kind of on the healthcare data piece and where we saw that, many years ago. I think one of the most obvious differences between then and now simply is the amount of data. 15, 20 years ago, we were just starting to see more mainstream use of EHRs, really, but there was still a whole lot of paper in healthcare. And if you think about it at that time, where were your records? For the most part, they were with your PCP, maybe a specialist or a hospital here and there. But once PHI became electronic, became ePHI, that sort of exploded, and your data is really everywhere now. I know you and I are both Apple Watch wearers, right? So 20 years ago, Apple was focused on fitting our music library in our pocket. But now Apple has our health data, and we can connect to our health record from our phones. Luckily, we can also pretty much get any song we want on top of that. But another example might be like Amazon. So again, back then, 15, 20 years ago, they had kind of started expanding into e-commerce, and not from they started as just books, right? But now they're your pharmacy. So there's data really to be had everywhere. And then so going along with just the healthcare data piece, there's the cybersecurity side of the discussion too. But I think the story is kind of the same. It's everywhere now. It's certainly part of many of our lives on a daily basis. It's part of the conversation everywhere. So awareness has really increased. When I first started, basic security controls might have been, making sure to change your password, having a password period. So that was a long-winded answer, but
You covered some good ground there that, that might set the stage for this discussion, and I like your perspective with Amazon and Apple, right? Because I think when you think about cybersecurity and healthcare, we might just be thinking too narrowly, right? Just within the walls of my PCP office or just within the walls of the hospital, right?
Yeah.
But to your point, it's in every nook and cranny at this point, right? From your wrist to your pocket to your PCP, you've got healthcare data, right? And all is at risk and all is under threat to some degree. Right. And the last episode I was on, I was talking with an IT leader from a hospital, and her comment was how much every single thing connects into her network, no matter what it is, from from copiers to MRI machines to security cameras, it's all plugged into her environment now, right? And she was hitting at a similar theme that you're getting at, right? Which is healthcare data and risk to healthcare data from a cybersecurity threat is sort of in every nook and every cranny.
Exactly. It's an expansion of the amount of data, but it's an expansion of the attack surface, right? So there's technology everywhere. Copiers, obviously, hospital beds are connected. There's all sorts of medical devices, insulin pumps and pacemakers. Our bathroom scales connected to the internet. But when there ends up being targeted attacks against those sorts of personal devices, there's life-threatening consequences potentially for patients.
Yeah, that kind of gets us thinking a little bit about risk and threats, and I think about classic likelihood and impact, right? And what we're hinting at there is what's the impact if this is under threat a little bit, right? The impact of my watch, okay, might not be life-threatening. It might be privacy concerning, depending on what I'm tracking on it and what gets out and where. But if it's an insulin pump, to your point, that's under attack, or a diagnostic imaging machine that's important for the emergency department, that has a different kind of an impact to the organization.
Right. So, there's all sorts of different considerations in that kind of risk management discussion.
So you see, laid a groundwork, I think, for us to keep working this, which is the data is much bigger. The attack surface, using your language, is much broader.
Right.
And the threats are evolving. So maybe speak there a little bit in terms of what you've been seeing in changes in threats or technology or approaches that security teams are using. What are you seeing as some of the evolving, changing things over the last few years in your career?
Yeah. Well, let me start with everybody's favorite topic, I guess, and that's, well, maybe not, depending on who you ask, but that's ransomware.
Okay.
Hot topic, obviously. Feels like there's a new headline, certainly every week, if not every day, about the latest victim. But I think the challenges that healthcare organizations face in dealing with ransomware is preparedness. So if they don't have the proper plans in place, then that type of attack can be devastating both to the business, but again, there's patient safety ramifications too. If care can't be provided because providers can't get at the data that they need, then there's a patient safety part of that discussion. In terms of other threats and vulnerabilities that are out there, one of the leading research avenues on this is the Verizon data breach report. And healthcare is always one of the industries that's included in that. I think what that tells us is that it's sort of a common refrain, but it's no longer if, but when, you're going to experience some sort of incident. I think in the 2022 report, the top pattern of attack that they identified for the healthcare industry was called basic web application attacks. But I think that it still goes along with what we were saying, is that there is that expanded attack surface. There's more web applications to attack, and I think the number was around 60% that those types of attacks made up for healthcare. I do think what is interesting, there was also in that Verizon report, is that the other 40 or so percent is really around insider threats for healthcare organizations, which is something I think that everybody needs to be thinking about, whether you're in healthcare or not. But for healthcare, insiders have traditionally ranked as much higher of a risk than other industries. This year was a little bit different in that insiders, they were 2.5 times more likely to make a mistake than doing something malicious. But at the same time, I think that it still suggests that there is sort of a people element to that discussion.
You hit on a number of interesting thoughts there, and we might want to just kind of follow up on a few of them.
Yeah.
Individually. And I'm going to start with the last one, which is sort of that insider threat, because that's an interesting perspective. And I think most thinking that clients may have jumps first to the external, the outsider threat, the ransomware. And yes, you have the employee who may click on the link or open the attachment that is the way the external threat got in. But it was an external attack, right? Not an internal attack. And internal attacks may not be malicious, but some could be, right? And it's probably less frequent that they're a malicious internal attack. But I'm going to ask a follow-up question that you just got me thinking about, which is, burnout right now in healthcare is at an all-time high. I think our colleague Vienna mentioned, I think it was the Surgeon General put out, clinician burnout is one of their top priorities for the coming year, right? And we talk about the Great Resignation, and we talk about the staffing challenges are number one. The number one topic of every client I'm talking to right now is staffing, pretty much, right? So if we overlay that staffing challenge world we're in right now against insider threat being a higher likelihood in healthcare, whether it's not malicious, just kind of skipping a step or moving quickly or being careless, or a disgruntled employee with a high stress environment that we're working through right now. You really got me thinking there. Any thoughts on that? If we look at the world we're in right now in healthcare, that is a higher level of threat. Any thoughts or reaction you have?
I think it's something that organizations need to be paying attention to. And the burnout is a well-being discussion, right? But like you said, does that lead to carelessness? Does that lead to somebody, uploading a batch of data to the wrong FTP server? Those sorts of things. So how do leaders and how does an organization support their team? And it's providers, but it's everyone on the team, right? The cybersecurity professionals are facing the same type of burnout right now. So is it somebody that configured the FTP server incorrectly, insecurely? So it's just something that people need to be paying attention to. I think you're right.
Yeah, and if I'm not mistaken, I believe one of the tactics that external actors use to exploit a potential client or target is kind of urgency. That's one of their tools, right? Send an email with some sort of urgent call to action that makes you feel like I got to move fast on this thing. They spoof being your boss with some request, right? Or they say, hey, the tickets to the baseball thing fell through. Who wants them, right? There's some call to action that's urgent. And what they're hoping for is the person doesn't stop, think, and say, is this real? Right? They click, they reply, they open, they do whatever the action is that they're looking for quickly. And then they find themselves in a pickle.
Right. Perfect example.
So you overlay that with burnout, right? And you kind of start to have better conditions for the external actor trying to exploit the internal person.
That's right.
Are you seeing any evolution, or are you seeing any thinking in the training, security awareness training our clients are doing in terms of recognizing that, thinking about urgency and burnout and the human element, and actually coaching their employees to think that way?
I think most importantly, before we even get there, is exactly what you mentioned, is to do security awareness training at all. Let's start there. I think developing that kind of awareness into the training program would be great, but let's, if we can, start with basics and at least have an awareness of what you're looking for. And oftentimes, we see phishing simulation programs where you kind of have those tests where it's a spoofed email from the boss. Those are great activities to do. It's always fun to see the click count, who are your clickers, who you need to go visit maybe. Can be scary to see who your clickers are too, though.
Well, and doing exercises like that, figuring out who your clickers are and doing proactive tests like that also, I think, helps you shift the culture, the cybersecurity culture a little bit, if you do it well, right? There's awareness and there's culture, right? Because if you do that, you don't want it to be punitive, right? Like, you don't necessarily want people to feel bad necessarily that they clicked on the exercise. You want them to learn from the exercise, right? And ideally you want to build just that little bit of awareness that they get the real thing and they say, maybe I should call IT. Right?
Just stop and think. Just stop and think for just a second. Yep. But it's exactly that. It has to be a culture. We kind of talk about the 90-10 principle all the time. 90% of security controls have some sort of human element. And I know you want to tell us about your favorite comic?
Well, yeah, there's that cartoon, right? I think we've all seen it in secure presentations everywhere, but I like it for this exact reason, right? It's sort of it shows that boxing ring, right, with an announcer, and the announcer saying, in this corner we have, firewalls, encryption, antivirus, and in this other corner we have Dave. Right?
Dave,
and
that's who it is, Dave. Yeah.
We happen to have a colleague named Dave, but that's not actually who we mean. But the whole idea is we can put all these technology instruments and protections and technology in place, and it still can just be the person clicking in that link or opening that attachment or doing the action, letting some stranger in to the hallway, sure, right? With traditional, like, physical intrusion, sure, social engineering type attacks, right? It's the person not stopping and thinking.
Right.
They can get in your way. So let's pivot and talk more about the human element. We've been getting into it already, but what are some of those best practices you've seen for organizations that kind of think about that human element and coach up the right aspects in their workforce? You mentioned the training, but what else should go into that?
Well, it has to be consciously and consistently and deliberately maintaining that culture of awareness of security and of compliance. So the workforce, your employees, your staff, they have to take training, but they also need to know their responsibilities and their roles in protecting data, right?
Yeah.
And part of that is having good, thorough policies and procedures. And part of that is your employees having an awareness of those policies and procedures. So it can't be a set it and forget it exercise, right? It's not a one and done deal. It has to be continuous and ongoing.
And you hinted at policies and procedures, which really aren't the most exciting topic when it comes to cybersecurity discussions, but they're so important to being fundamentally sound, right? And I know you and I have talked about this before, but having a policy and a procedure is great, but you got to actually follow them. Yeah, you actually have to
That's it.
do them, right? You can almost be worse off if you have something and you aren't doing it, right?
Yeah.
And you have to have a culture that supports people doing the right thing, right? So take an example. Someone, has their laptop in their car, stops at a grocery store, has it stolen, broken and stolen, right? Because the lost or stolen unencrypted thumb drive or unencrypted device has long been one of those frequent flyers on the HIPAA bad list, right?
Yep.
But you don't want the employee to then say, "Oh, I'm going to keep looking for this all weekends and next week and not tell someone this has happened," right? Because they're fearful of being in trouble. You want that person to say, "Wow, that wasn't good, but my first call is to IT or whatever that procedure should be for the situation when it occurs."
Right.
And so that takes an organizational culture that embraces and allows employees to do the right thing at the right time in the right way.
Right. I'll give you an example of a recent example. I think just within the last week or so, the Connecticut DCF, Department of Children and Families, reported that I think it was over the last 4 months that they've lost track of 100 or so laptops. So what happened to those? Where did, like to your point, where did employees report those missing machines? What happens to those assets? And then obviously if there's just those floating around out there, that's a whole other discussion and what data's on those. But again, the culture, like we were saying, needs to be that your employees are comfortable with reporting what they see and what they do.
Because inherently humans are going to make mistakes no matter how well trained they are, right? And so when that happens, we want them to report it, to your point, right?
Bingo. Yep.
I was at a conference years ago and they had a cybersecurity panel, speaking. And these were cybersecurity professionals from some of the largest health systems and companies out there. And I remember one of them describing to me that they actually had I think they described it as a cybersecurity range for their security team. Sure. Like a shooting range, right? So they could practice their techniques in a simulated, practice environment, right? Which sounded unbelievably sophisticated, right? And most organizations don't have the resources to have that sort of a commitment to it. But that same panel, when they were asked at the end, what's the most important thing that anyone in this audience should do? They basically said it's not the whiz bang. It's not the most elaborate stuff. Do the fundamentals and do them really well, was sort of what their advice was after this lengthy discussion around their cyber range, right? And
right.
It really resonated with me, and I'm curious if that resonates with you in your experience.
It's basic cyber hygiene, right? So there's, yes, there is an expanded attack surface. Yes, there's all sorts of new technology, but the basics go a long way. Tracking your inventory, the DCF example, basic cyber hygiene controls go a really long way. Do the basics, do it well, like you said.
For an organization that resonates for right now, and they're saying, gosh, I need to wrap my arms around the basics to do them well, or maybe even an organization that's further along and pretty mature, but says, hey, I want to check, my basics and see if I'm doing them well. Are there any good frame of references, any good security controls or frameworks that you think are good ones to consider if someone's wondering about how am I doing fundamentally?
Yeah, there's quite a few to choose from. But I would say one of the ones that we're seeing a lot of work with right now, the Center for Internet Security Critical Security Controls, used to be the top 20. We're now down to 18, so the top 18. But they do a really good job of breaking apart the controls. Not to get too detailed, but they break them into what's called implementation groups, and it's really about the size and complexity of your organization. So if it's a little, I'll stay with healthcare example, but if it's a small practice of say 5 or so providers, they might be in what's called implementation group 1. So they're a smaller shop, and don't need all of the advanced controls that a whole hospital system maybe, who would be implementation group 3, and the controls get more complex as you advance. Center for Internet Security Critical Security Controls is a good one. NIST has all sorts of different flavors out there. The cybersecurity framework. Those are a good place to start.
And even in those examples, you're a group 1 or you're group 3 in those internet security controls. Whichever group you should be in or you fit best into, you want to be fundamentally sound at that level, right? You kind of want to think about that and say, all right, in group 1, I don't need an elaborate, but the things I do need, I want to do really well.
That's exactly right.
One last thought, and then we'll maybe take it to the home stretch question. But earlier in this discussion, you mentioned something that's said time and time again now in cybersecurity discussions, that the it's not if, it's when statement, right? And that kind of comes up, and it's been a bit overused, but at the same time, it's relevant. And I can think back to a conference I was at, and I was presenting on HIPAA security, and we were taking questions at the end. And I remember someone saying, I'm a small rural health system and kind of in the middle of nowhere. Why do I need to worry so much about this? Right. And I think that speaks on the nose to, it's not if, it's when, right? Like, you may be small, you may be in the middle of nowhere, your attack surface may be smaller, your data may be narrower, but maybe your IT shop is smaller, maybe your controls aren't as elaborate, you may be an easier, more vulnerable target. So you may not be the big whale, but you might be the wide minnow that someone's looking for in a widespread attack, right? I don't know if you have any thoughts on just digging into that it's not if but when mindset.
Yeah, in terms of having somebody say that why do I have to worry about it? I think doesn't it go though to the whole point of healthcare, and that's protecting your patients, right? So you have a whole wealth of patient information, and those individuals have the right to have that information protected, and that in the healthcare world that we're in now, that involves security measures in place to do that. I don't know. I guess that's how I see it.
I like that. That do no harm. I can't quite put it right in healthcare, that adage, but if cybersecurity team is thinking about that and think about what do we need to do to be fundamentally sound, using that as the guidepost, right? Mm-hmm. We don't want to be down. We don't want to be exploited. We don't want to lose our patients' private, sensitive information, right? We don't want our operations disrupted and turning away elective procedures while we get the system up and running that may impact our bottom line and thus our viability in the community, right? These are the things that could harm us or harm the patients we serve, right? So
correct.
All right. Well, this is fun. Let's Now let's bring this thing home, Brian. Our colleague Danny started this tradition when he launched the podcast of a closing question. We'll keep it going, for today. So the question is, you have unimaginable amounts of money to spend on healthcare technology, and believe it or not, you have no regulations to adhere to, which is in healthcare kind of a shocking premise, but we're going to go with it.
Yeah.
If those conditions existed, what would be your top priority and why?
I guess my first thought would be I'd throw everything at artificial intelligence and research around a cure for Lewy body dementia, Parkinson's, Alzheimer's, so that the millions of people and families out there don't need to suffer.
Fair enough. So really pushing the research and using artificial intelligence to find it. Fair enough.
Yeah.
I know that every direction that AI can be focused right now, I think they're focusing in, but aiming everything we got at one might bring about some results.
Right.
Well, Brian, thank you so much. I certainly enjoyed it. I hope our listeners enjoyed it. Hopefully they're a little spooked and have a bout of insomnia, but then maybe look at some of those frameworks and think about, well, it's just fundamentally sound, and they can sleep better, afterwards. So
I like it. Thanks, Dan.
You're welcome. For our listeners, you can find our podcast on iTunes, Spotify, SoundCloud, and Google. Our next show will be coming soon, and we'll hope you will tune in. I'm Dan Vogt. You've been listening to BerryDunn's Healthcare Technology Insights. Thank you for listening. Be well and stay insightful.